Exposed Newborn Fall Forum. While we were so hopeful that we would be meeting in person, alas, we are here via Zoom again, but I am still so thankful that we're able to gather even in this platform. We have such a tremendous day of information, collaboration, conversation for you. And so we are real excited that you will all be active participants in today's session. Next slide. All right, first thing I will say that please do use a hashtag chosen forum to share your experience about the event on social media. Now, we'd like to know who you are, where you're from, what organizations you represent, what you're most looking forward to today. So please start chatting in these things. Next slide. By now, I'm sure you've all experienced the squirrel scale, but we would like to know how you're feeling today. And so Cassie, our awesome tech guru, will be chatting in the Mentimeter link. And so please pick which one represents how you're feeling today, and you'll see the results coming up live. Let's see here. We got lots of number sevens. Seven's looking a little, I don't know, a little timid, maybe pensive, or that's my interpretation of it. Everyone looks at these things and assesses different characteristics. Number 4, oh gosh, the pumpkin on the head. You guys are feeling the fall, feeling Halloween. I like it, I like it. Let's see what else we got here. We got some number 9s. Oh, I hope you got your snack packs that illuminate coordinated. That's, I hope, what you're eating after you had a healthy breakfast. Let's see here. Ooh, okay, we got quite the spectrum. All right. We got just one number 1 though, interesting. And then one, oh, there's someone who's not feeling so hot, number 5. Ooh, well, hopefully by the end of the forum, you're gonna perk up a bit. You gotta wake up. Let's see here. And then a bunch for number 6. Arms crossed. I'm thinking this is like maybe deep thought, just waiting to absorb the wonderful information you're going to get today. All right. Well, you know, I think in general, people are ready for fall. Some people are feeling like they're already thriving, but it's great. I'm hoping that by the end of today, we're all going to feel like a number 8, like just living and thriving. All right, let's move on. Next slide. And also now through the Mentimeter, please do select which area you're representing or what perspective you bring to the forum today. And we'll see the results pop up here live.
And if you're having trouble getting to the second question, it should have popped up at that same original link. Once you submitted your squirrel, it should have gone to the next one to let you choose your perspectives. But if you're having any issues, let us know and I can pop the link back in the chat as well.
Maybe folks are having trouble. I don't see anything popping up.
I filled it out, but it wasn't popping up now, so I don't know.
I was going to say, it could be the embedded is finicky. Maybe we try going back and coming back to this slide. And if not, I can certainly screen share the browser version.
Yeah. And you know, no worries. If we go on to the next slide as well, we're going to ask you again to please share who you are and where you're from, who you represent. Because I mean, this is where I do one of my favorite things where I pretend I'm a Peloton instructor and I do all the shout outs. So let's see here. We got Christine Golds, pediatrician, medical director for University Level 1. Hey, Christine, good to see you. Jen Johns from Fort Collins, great. Mandy Cedar from the CHA. Billy Warren, Lutheran, thank you for joining. Elena Sayers from intern at CPCQC, and you're working remotely from Vermont. Ooh, love New England. That's where I spent almost a decade. Let's see here. I'm scrolling down. Lisa Licata, thank you for all your hard work. Pat Mosby, great to see you. Jody Womack. Hey, Rob Dietz, looking forward to your talk. Steph Bork, who's just down the hall. Michelle, Mick, good to see you from Valley View. We got a bunch of Chosen Quick steering committee members as well. Stacy Sandy, I hope you've adjusted to life at CPCQC. Kathy Wells, looking forward to your talk as well. Lauren Bruns, thanks so much. If I forgot any of you, I did not mean to. You'll have to ride again, and then I will call you out. Okay, so still great to see you all. Next slide. So before we move on, I want to acknowledge that Chosen and Chosen Quick is truly a collaborative effort. And while we first started at the School of Medicine, Department of Pediatrics here at the Anschutz Medical Campus, focused on birthing hospitals, we really quickly expanded throughout the state beyond birthing hospitals, beyond even our own state into Wyoming, Montana, really because we were able to collaborate so closely with Illuminate Colorado, as well as our state perinatal quality collaborative, CPCQC. So truly, we are so thankful for this collaborative effort. And so we have JB Cabrera here, who's the Executive Director of CPCQC, Jade Woodard, the Executive Director of Illuminate Colorado, and listed below are the Chosen Quick Steering Committee members. So it's really on behalf of all of these organizations and individuals you see listed that we welcome you and hope that today is a fruitful 4 hours spent with us. And now I am going to share my screens. So I'll wait for Jillian to stop her share. Excellent. Fingers crossed that this works. All righty. How's that looking? Give me a thumbs up, folks. Excellent. All right. So we have an awesome agenda for you today. We're in the middle of welcome and introductions right now. Then we'll be followed by our keynote, Back from Broken, from Vic Bella. We'll provide a chosen data funding and policy update, have a brief break, and then have our second keynote by Dr. Elizabeth Krantz, focused on designing healthcare delivery approaches for pregnant persons with substance use disorders. Then we'll have our third keynote from Dr. Robert Dietz, entitled Darkness Flooded in Light, A Physician's Journey in Addiction and Recovery. We'll have our second brief break and then conclude the day with chosen hospital updates from Dr. Kathy Wells about the Navigator program, Amy Dempsey about the systems-wide effort focused on substance use disorder within SEL, and then we'll hear from Sharice Minnick and Lucretia Smith regarding the San Luis Valley effort. And then we'll conclude with a brief wrap up. So I have a few slides for this introduction, and I think most notably, I really thought we would be doing this. You know, I thought we'd have this huge turnout in person, and it would have been a fabulous in-person day-long forum. And in fact, I think our turnout would have been this large. This was when I attended Michelle Obama's book tour in Denver at the Pepsi Center back in 2018. I have no doubt that our gathering would have been this large, and we would have been rocking it, right? This is me on the left, just like living my best life as Michelle Obama is talking to me and giving me her wisdom. And then on the right, there's just this guy. He was seated a few rows away from, this is when Steph Bork and I went, and he was truly living his best life. He was just partying and thriving. And I really hoped that it would be this way. But alas, as I mentioned, you know, I am still very thankful that we're able to convene virtually. And I know that since we last met in April from our spring forum, so much has happened and continues to happen, but I am always impressed by the stories and experiences that I'm hearing from all of you throughout our state, in the Rocky Mountain region and on my campus as well, that, you know, on some days, I think we're killing it. You know, we are helping families, providing bedside care, doing research, increasing our presence in the public health arena to really support families impacted by substance use. But I also absolutely understand that during this past 18 months, we feel like the person on the right, where it is just too hard and you just want to crawl under a blanket and not come back out. And I personally have felt both of these extremes. You know, regardless of where you all are today, I really do hope that you are emboldened emboldened, educated, and inspired to have the energy and the will to perhaps on some days be like that person on the left, so that we could really center our families and support them through these difficult times. Because you know what, these families and communities, they need us, because the data shows us that we are not heading in the right direction. And this pandemic is certainly not helping at all. And so shown here is data from CDPHE, and this is Colorado mortality data from 2000 to 2020. This is raw data, so this is count data of deaths. And these are drug overdose deaths due to any drug per year. And what you'll note is that absolutely we've been seeing these increases from 2000 onward. Also keep in mind that a Colorado population has certainly grown. So we anticipate, unfortunately, that the frequency of deaths would increase as the population increases. But what we do not anticipate is the slope of the line to be as steep as it has been from 2019 and onward. So you can see moving from 2020 onward, that line is quite steep. And so that is absolutely outside of the bounds of what is anticipated, even with population growth. And so we also have to be mindful that disparities are beginning to appear. We know that racial ethnic disparities in perinatal health, substance use disorders, and outcomes have always been present, but there is the possibility that here in Colorado, it may worsen. The graph that I showed you previously was aggregate data, not stratified by race, ethnicity, but what I'm showing you here is data from California. This is a busy slide, so stay with me here. So here in this study, investigators used quarterly age standardized overdose mortality rates from California, and it's stratified by race, ethnicity, as well as drug type. So you see on the upper left, you've got all drugs, and then you also see fentanyl, methamphetamine, cocaine, benzodiazepine, and heroin. Asians are represented in the red line, Black or African American in the orange, Latinx in the light blue, and then the dark blue is the white. And so what they're doing here is that each of these dots are actual data points. Those are actual mortality rates due to these various substances. But where you see that shadow on the right side of each of those graphs is what they tried to do is in this study, try to predict based upon the trends from 2014 to the first quarter of 2020, what should have been the mortality rate by race ethnicity for the remainder of 2020, i.e. during the COVID epidemic. And so what you see, the lines are the predicted, the dots are the actual. And so what you're seeing is that for every racial ethnic group, the actual overdose rate during the COVID pandemic far exceeded that of what was anticipated if they used that prediction modeling. But what's also most notable is that the Black-white gap increases significantly during that predicted time period. And so we know that, that Black communities are, due to structural racism and a number of other social determinants of health, have far worse health outcomes. But for substance use, I do think this, at least for recent times, has been less of a focus. If we think about the 80s, absolutely, there were racialized minorities were certainly stigmatized and frankly kind of punished, whereas now we've adopted a much, perhaps some would say, a kinder approach to substance use for a majority of the population that were white, but is quickly changing. And what's also notable from this study is that this Black-white gap, investigators hypothesize, is really due to an increase in deaths from methamphetamine, cocaine, and fentanyl in Black communities. And that growing racial disparities in overdose must be understood in the context of unequal social and economic fallout from the COVID-19 pandemic. Now, what about our birthing population? This is a lovely study that was done by investigators from Harvard, and it was an international study that sought to identify and measure the association between pandemic-related information seeking, worries, and prevention behaviors on perinatal mental health during the COVID pandemic. So this was quite a feat, where it was an international survey administered online to pregnant and postpartum women from 64 countries from May 2020 to June 2020, available in 12 languages. So you can see here the number of participants that are represented and the countries where they're from. And so here we see some of their results. So this is prevalence percents above threshold for the 3 mental health outcomes of anxiety, depression, and PTSD. On the very far right is the pre-COVID prevalence estimate. The middle is during the COVID pandemic, and then on the left is the general population. And what's remarkable is that pre-COVID, perinatal mental health was better than the general population, as you can see, with much lower prevalence estimates. However, during the COVID period, peri and postpartum women experienced a tremendous increase in anxiety, depression, as well as PTSD. And when women were asked, what are they most worried about related to pregnancy and delivery? These women reported the following: that family were not able to visit after delivery. They were afraid the baby would contract COVID, lack of a support person during delivery, COVID causing changes to the delivery plan, and then greater worries about inadequate childcare and overall infection risk. And so we can see that our perinatal population kind of worldwide absorbed so much of these negative experiences and influences during COVID and worsened their mental health. And we know that mental health and substance use are nearly a Venn diagram that go hand in hand. And so this has been an incredibly stressful time during this pandemic. And unfortunately, barriers to treatment services and other supports have been constrained and limited due to the pandemic. And so shown here is data from the Colorado Health Access Survey, which is our state source of information about health insurance coverage, access to healthcare, and use of healthcare services. So this is a survey that happens once every 2 years, surveys more than 10,000 households. And so this is data from 2019. And so shown here is household report or individual report of needing substance use treatment but did not receive treatment. That's shown in the orange yellowish bars. And then in the black bars are just the overall Colorado average population. So for instance, ages 24 to 39, that age range represents about 19.4% of our Colorado state population. And yet they were overrepresented by 53% as a group that needed but did not receive treatment services. The overrepresentation also is seen amongst men at 74.9%, and then also amongst our poorer communities, where federal poverty level of 200% is represented in 28% of our population, and yet nearly 50% in that group that needed but did not receive treatment. And so what were some of the reasons for not getting treatment? Shown in the light purple is 2017 data, and shown in the dark is 2019. And you can see that in this very brief time period, there's been a significant increase in the percentage of folks reporting that A, they did not feel comfortable talking with health professionals about personal problems, and B, that they were concerned what would happen if someone found out that in fact they had a problem. Additional reasons: concerned about the cost of treatment. They had a hard time getting an appointment, nearly a third. More than a half reported that they did not think health insurance would cover substance use treatment, and more than 20% reported not having any health insurance. And so an additional data source I think that is really important to think about is this data from the Colorado State Epidemiological Outcomes Work Group. It's a network of state agencies and data experts that were brought together to examine the patterns, context, and impact of substance use. They have a lovely report, and this is just 2 data points that I pulled out. The first is, since 2010, there's been a 44% increase in people seeking treatment. And yet, as the prior slides demonstrate, they are seeking treatment, but there are certain barriers to it as well. And 42% of treatment admissions in Colorado are now for methamphetamine or heroin. To the right, you see that polysubstance use is increasing dramatically, namely with methamphetamine and heroin since 2014. And unfortunately, individuals that have polysubstance use are 3 times less likely to receive treatment than those that have either alcohol use or a single illicit drug disorder. And so as you'll see as this day progresses, this polysubstance use is absolutely a critical barrier, a problem that we have in our perinatal population as well. So lastly, I want to talk about our birthing population. This is data from our Colorado Pregnancy Risk Assessment Monitoring System, as well as Health eMoms, an electronic longitudinal survey administered by our health department. And so what's notable here, the first point I'll make, is that prior to pregnancy, shown here in gray on the left, that there are fairly high prevalence estimates of substance use among our birthing are women of reproductive age, such that 75% of women report using alcohol, 21% report using tobacco, and 17% report using marijuana. However, by the 3rd trimester of their pregnancy, while those rates are not zero, they decline significantly. Alcohol by 81%, marijuana by 76%, and tobacco by 64%. And while our hope is that we can act earlier, way before pregnancy, in providing education and supports for women with substance use to even prevent the initiation of substance use, until we get to that point, we do know that pregnancy is a window of opportunity to engage birthing individuals affected by substance use. And the data shows us that cessation from use is certainly possible and does occur during pregnancy. Unfortunately, I'm going to highlight this last box on the lower right, that according to the Health eMom survey, people who are 12 to 14 months postpartum binge drink at a higher rate than the average rate for all women of childbearing age. So for all of you that are participating, I think we all know that that first year postpartum is so difficult. And yet we focus so much on pregnancy and birth hospitalization. But I ask you and myself and others, what are we doing to support mothers, children, and families after birth? And why is it that substance use rates increase astronomically? And moreover, why is it that maternal mortality increases not immediately after birth, but into the first year postpartum? And so clearly we have a lot of work to do to better support our families and to recognize what are their barriers to receiving the supports and services that they deserve.